Did you know that 8 million Americans are uninsured? That's 27 million Americans with no health insurance. In some states, it's worse than in others. In Massachusetts, 2.6% of the population is uninsured. In Texas, it's 16%. 11% of Americans cannot afford health insurance. Why is this? Why is health insurance unattainable for so many and so expensive for so many? Well, let's take a look at the underlying dynamics. Did you know that in America there are over 900 for profit insurance companies? That's right, 900 for profit insurance companies. That is a multitude of high paid insurance executives whose function it is to deny your claim as often as possible. United Healthcare leads the pack in insurance claim denials, denying a roughly one-third of all claims. That makes making your insurance premium payment into a Las Vegas style betting operation. You pay and you pay and you pay. And when you go to the doctor, when you go to the hospital, there's a 1 in 3 chance you're not going to get reimbursed or your claim is going to be denied. Those are a little bit scary odds, especially if you are in for something serious and expensive. The United States rates last among the 11 highest income countries in overall performance regarding healthcare. The numbers 1, 2, and 3 countries are Australia, Netherlands, and the UK. Uh, we rank behind most European countries as far as overall accessibility to healthcare. On the world stage, we rank 69th in overall accessibility to healthcare. Let's compare that to the number one ranking country for accessibility to healthcare. Does anyone have a guess what that country might be? Care to wager a guess? It's not a big country, it's a small country. It is a democracy where democratic socialism is the order of the day. And in this country, 99.9% of the people are covered by universal health care through a single payer system. That country is Taiwan. Taiwan, with its 23 million people, has a single payer universal health care system, which is the number one ranked system for overall accessibility in the world. And we are talking not about a lower level of service, but we're talking about world class service with state of the art facilities and state of the art hospitals and clinics that are available and open in all neighborhoods at all times. Here's another interesting fact about the Taiwanese healthcare system. Everyone is in the same plan. Now, if you're in America, you understand the frustration of having insurance. You might even have good insurance, but when it comes time to see a doctor or a dentist, you've got to do your homework and figure out which doctor and which dentist you can see because many of the dentists and doctors who are in your neighborhood and most easy to get to are not in your plan. I can speak to this from personal experience. When I lived in Florida, I had Florida Blue. Now, I wanted to see a dentist and I started calling around, do you accept Florida Blue? Well, they said, what kind of Florida Blue? Do you have Florida Blue HMO or Florida Blue PPO or Florida Blue STP or PCP or, it's SRO or WTF? What kind of Florida Blue do you have? Well, by golly, It's Blue Cross and Blue Shield. It should work at any dentist. But no, I had to hunt around, and I hunted around, and I couldn't find the dentist who accepted Florida Blue, the type that I had. And so I eventually decided, well, I'm just going to get my teeth cleaned. It can't be that expensive. And I booked a session at the nearest dentist, and it cost $160 to have my teeth cleaned. Now, anyone care to guess what that would cost in the world's number one country for healthcare accessibility, Taiwan? That would be $5, folks. $5 to have your teeth cleaned. Now, it's not completely free. Everybody's in the same low cost healthcare program. If you are high income, you might pay $60 or $70 a month to be in the program. And if you're low income, you might pay around $30 to $35 a month. Um, Once you've paid your 30 or 35 or $60 a month, you have access to all the doctors and all the dentists, all the clinics, all the hospitals in the country, which is uh, which is a wonderful thing. That means if you get sick, you don't have to fish around and try to figure out who's not going to rip you off. You just go to the nearest clinic, doctor, hospital, and you pay your $5 registration fee, and you see the doctor or the dentist, and you take care of business. And let me mention also the $5 that you pay for the registration fee also includes any prescription that you get. Imagine that. You go to the doctor. Maybe you are suffering from the flu, or you've got a bad cold, or you got some aches and pains you want to have investigated. Well, you pay $5 at the desk to register to see the doctor, and the doctor takes a look at you, figures out what's wrong, and he says you're going to need some medicine. Of course, near every hospital or in every hospital and near every clinic, you will find a pharmacy. Uh, in most cases, if you go to a clinic, you will be told you go next door to the pharmacy, and they will. We've already called in your prescription, and that is included in your $5 registration fee. In countries like Taiwan, Australia, the Netherlands, Great Britain, Canada, Singapore, Denmark, Switzerland, Austria. I could go on and on. In countries like this, healthcare is regarded as a basic human right. It's not a luxury afforded to people who happen to be lucky enough to be working at places that provide healthcare insurance. That is one of the banes of working in the United States. A lot of the low paying jobs do not have health insurance. Now, let's say that you're working at McDonald's, you're on an hourly wage, and you get injured on the job or you get sick. Well, too bad for you. You don't have health insurance. You're getting paid by the hour, and there are no benefits included. A lot of companies operate that way. As a matter of fact, companies like Walmart have raised insurance denial to its employees to a fine art by scheduling them for fewer hours than are required. Uh, if you only work 29 hours, you're not eligible for unemployment or for Social Security, or excuse for health insurance. And so a lot of these places will be very careful not to schedule you for more than 29 hours. That's a one of their one of their prime ways of avoiding the responsibility of providing health insurance for their employees. And meanwhile, the Walton family who owns Walmart gets richer and richer, and the folks who own McDonald's franchises get richer and richer, etc. You get the picture. Uh, the less money that a company has to pay to provide health insurance for its employees, the more they can put in their pocket, especially on the high end, the CEOs. Um, what else do I want to say about this? Yeah, I want to reiterate in Taiwan, 99.9% of the population is covered by insurance. And that includes guest workers in the country as well. That's not just the citizens. If you come to Taiwan and you teach English or you work in a science park as an engineer, as soon as you get your job, you also get your health card. And then you are covered for the same as any citizen. There's no 90-day trial period. There's no 6-month waiting period. There's nothing like that. You get the insurance right away. Why can't it be like that in the United States? Certainly the world's richest country with infinite resources, lots of good doctors and nurses and hospitals and dentists, uh, should be able to provide health care to its citizens. The problem is it's regarded as a for-profit enterprise. It's not regarded as a utility, as a human right. And that's an attitude problem. That's a philosophical problem. That's the wrong way to look at healthcare. Healthcare should not be for profit. It should be for the people. One of the reasons that Taiwan is able to offer the medicine for free after you've paid your $5 registration fee is because the Taiwanese government negotiates with drug companies in this way. They go to the drug company and they say, look, how would you like a customer that represents 23 million people? And the drug company says, well, if we could sell drugs to 23 million people at one crack, that's a pretty good customer right there. And then Taiwan says, well, give us your absolute lowest price. And the drug companies, they may squawk about it, and they may try to negotiate, but in the end, Taiwan ends up getting a wholesale or near wholesale price for drugs, and that goes right across the board for medical supplies as well. And then, of course, you have the fact that the national health officers or the National Health Insurance Office kind of looks like a well-run DMV. You don't have high-paid executives in the skyscraper in the corner office with the good view out the glass window of the city. You've got office workers in their cubicles, pushing the buttons on a computer and making sure all the paperwork is squared away. And they're not making a fortune; they're just making a regular living. Again, it's not a rapacious system where an executive is bringing home $10 million a year because he and his company have figured out how to deny claims. It's not that way. And it's not that way in much of the world. So it's time for the United States to take a good hard look at a single payer system which benefits all citizens. If it's done efficiently, if it's done across the board, costs can be brought down and everybody receives the benefit. Uh, the United States, as it currently works, your insurance is tied to your job. Many of you, including myself, have experienced this where you leave a job and you lose your health insurance. Now, the last job that I left in the United States, my employer at that time informed me that I was eligible to continue the same insurance that I had through the COBRA system. I'm not sure what the acronym stands for. It's a snake, it's a snake. Um, Cobra is a snake that's poisonous and it'll bite you and it's not good for you. So it's aptly named. But I believe the cost for me would have been about $650 or $700 a month, as opposed to uh, my insurance in Taiwan, which is $33 a month. Now that I'm retired and I'm not making an income here, I qualify as a low income recipient of health insurance. My wife is Taiwanese, and I have a Taiwanese green card, and I spent some time in Taiwan, and I spent some time in the United States, and I maintain my healthcare uh, card, my insurance here in Taiwan. $33 a month keeps me in the system. As a matter of fact, the last time I got sick in the United States, I went to an emergency room. It was just a clinic in the neighborhood, really. They billed themselves as an emergency room, but I was suffering from pneumonia. It was hard to breathe, and I went in, and they put me on a nebulizer or inhaler, really, for about half an hour or so, and took an X-ray and blood test, and gave me some pills, and they gave me a prescription for a not a vaporizer, what is that thing called? Anyhow, it's inhaler, a prescription for an inhaler. Now, it turns out you can buy them over the counter, but hey, any way they can make money. So yeah, and I was there for 2 hours. I was there from 10 p.m. until midnight. 2 hours. Anybody want to hazard a guess how much 2 hours in a neighborhood clinic billing itself as an emergency room costs? $8,500. That would have cost $5 in Taiwan, folks. $8,500. My insurance company got stuck with $5,600, and my insurance my no $5,800, and my portion was $2,700. My If I remember the numbers correctly, my 20% copay $2,700. The cost of being sick, and I had insurance $8,500 for 2 hours in a neighborhood clinic, billing itself as an emergency room. Mind you, I did not occupy uh, a hospital bed. I didn't spend the night. I wasn't there overnight. There was no operation. I drove myself there. There was no ambulance ride. Everything was wildly overpriced. Imagine that going on every single day in every single city throughout the United States. Exaggerated costs, denial of benefits. I could do the research and give you the rest of the companies. There's 900 for-profit insurance companies. United Healthcare made the news a while back when one of his executives got shot by a guy who was trying to draw attention to the whole healthcare situation. Luigi, I believe his name was. Um, and the guy who got shot, his compensation was $10.1 million per year, which is an obscene amount of money to be skimming from the premiums being paid in by the folks who are insured by United Healthcare. And sure enough, they deny 1/3 of their claims. So they have indeed many disgruntled customers. Can we do better? Can the United States do better? Of course it can. Of course it can. What's the holdup? Well, I believe it's called K Street in Washington. It's where the lobbyists have their offices, and the insurance companies are incessant lobbyists, and they put a lot of money in the pockets of the senators and congresspeople, the representatives and the senators. They bend the ear of your Washington representatives, and they encourage them to rule in their favor anytime there's discussion regarding bringing down the cost of health care. There's a lot of incentive to keep the system the way it is because guys like the fellow at United Healthcare who got shot making 10 million a year. Well, they would like to keep on making 10 million a year. And when you've got 900 companies and they all have high-paid executives like that, that's what you get. You get a whole army of lobbyists in Washington making sure that your healthcare costs remain high. Fractured headlines here. Like if you like, subscribe if you like. Catch you on the next video.